Transferring a patient from the bed to a chair. Good day, learners. This presentation will deal with the transferal of a patient from a bed to a chair and will assist in your preparation for assessment. Patients who are forced into inactivity due to illness or injury are at risk of developing immobility complications. Often, moving a patient from the bed to a chair helps him or her to begin engaging in physical activity and will help to prevent complications related to immobility. The safety and comfort are key concerns when assisting a patient out of bed. The use of the correct body mechanisms will assist in reducing the risk of injury to the patient and the care provider. Purpose: transferring a patient from the bed to a chair is a generic, basic nursing care standard to be mastered by all learners. Learners skilled in the standard will be able to promote patient mobility and prevent bed rest complications. Specific outcomes: learners who have been assessed and found competent in transferring a patient from the bed to a chair will have achieved the following specific outcomes and will be able to apply the correct body mechanisms throughout the procedure, perform the procedure without injury to the patient or to oneself, and will be able to monitor the patient for any signs of dizziness or lightheadedness. Embedded knowledge. Embedded knowledge represents what you as the learner has to understand and be able to explain in an area of learning and at a particular level. The learner should have mastered all the theory related to patient activity and mobility. The learner should have sound knowledge related to the anatomy and physiology of the musculoskeletal system. The learner should have sound knowledge about back safety. The learner should have sound knowledge about the medical legal aspects regarding the safety of a patient. And the learner should have attended a demonstration in simulation on how to transfer a patient from the bed to a chair. Range statement. Transferring a patient from a bed to a chair is a generic basic nursing care standard, and learners can be assessed in their field of learning in line with subject matter expertise. Procedure. The procedure on how to transfer a patient from the bed to a chair will be performed according to the nursing process. Please note that we will perform this procedure step by step, and it may take less time to perform during actual procedures. Assessment. Identify the patient. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient's records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows the patient as a second source. Explain the procedure to the patient and obtain the patient's cooperation during the procedure. Check the patient's medical records and the nursing care plan for conditions that may influence the patient's ability to move or to be repositioned. Appropriate nursing diagnoses may include the following: risk for falls, acute pain, chronic pain, impaired physical mobility, risk for injury, anxiety, and risk for activity intolerance. Assess for any medical equipment or surgical procedures that may alter the positioning procedure. These may include the following: intravenous lines, drainage tubes, oxygen therapy, or incisions or wounds. Assess and identify any movement limitations by the patient, for example, body mass, mental status, or physical condition. Assess the patient's ability to assist with the procedure. Identify the need for a second or third care provider to help with the activity. Assess the patient's pain level. If the patient experiences pain, report it to the registered nurse. Allow sufficient time for analgesics, if any was given, to take the effect before moving the patient. Planning. Before implementation, assemble the following equipment: a chair or wheelchair, clean gloves, a gown or robe for the patient, a pair of non-slip footwear, and a blanket to cover the patient while in the chair. Finally, prepare the environment by closing the curtains around the bed and/or closing the door to the room if possible. Move the furniture to make room for the chair if needed. Place the chair or wheelchair next to the bed, facing the foot end of the bed. Remember to lock the wheels and take the footrest out of the way. If required, arrange for 1 or 2 additional care providers to assist with the procedure. Implementation. Perform social hand hygiene. Ensure that the bed brakes are locked. Assess the patient's pulse to get baseline data. Adjust the level of the bed to an appropriate and comfortable working height. Put on clean gloves if expected to touch bodily fluids. Lower the side rail if required and stand in line with the patient's midsection. Open the top linen by folding it to the foot end of the bed. Assist the patient to turn onto his or her side, facing the side of the bed the patient will sit on. Please refer to the presentation on how to turn a patient in bed. Stand with your feet shoulder width apart, with one foot slightly in front of the other. Place your one hand under the patient's shoulder. Ask the patient to move his or her legs over the edge of the bed as you lift the patient's trunk and shoulder. This movement should be done in unison to prevent injury to the patient's back. If the patient is unable to move their legs over the edge of the bed, you will need a second person to assist. The procedure will be done as follows. Stand in front of the patient with your feet shoulder width apart and one foot slightly in front of the other. The second care provider will stand in line with the patient's legs. Ask the other care provider to place their hands under the patient's knees and ankles to lift the patient's legs off the bed. Place your one hand under the patient's shoulder. As you lift the patient's shoulder up from the bed, the other care provider should gently swing the patient's legs over the edge of the bed. Stand in front of the patient and assess for any balance problems or complaints of dizziness. Continue if there is no such problems or complaints. Assess the patient's pulse. Compare the reading with the baseline data. Please note, if the pulse is more than 20 beats per minute less than the previous reading, do not take the patient out of bed, as this may cause dizziness and may cause the patient to fall. After assessing the pulse, do a few active and passive exercises. Ask the patient to swing their legs. Point and flex their toes. To move their ankles in a circular motion, and to straighten their legs. Allow the patient to dangle their legs for a few minutes before continuing. This will assist with increasing the blood circulation in the patient's legs. Lower the level of the bed so that the patient's feet are close to the ground. Assist the patient to put on a robe or gown and a pair of non-slip footwear. Face the patient with your feet spread about shoulder width apart. Assist the patient to slide towards you until their feet touches the floor. Position yourself as close as possible to the patient, with your feet positioned on the outside of the patient's feet. Bend your knees and hips and keep your back straight. On the count of 3, use your legs to help raise the patient to a standing position. If indicated, brace your knee against the patient's weak extremity while he or she stands. Pivot on your back foot and assist the patient to turn until the patient can feel the chair against his or her legs. Alternatively, if the patient is able to maintain their own balance, the patient may take small steps until they reach the chair. Ask the patient to use the armrest of the chair to steady him or herself while slowly lowering into a sitting position. Continue to brace the patient's knees with your knees. Bend your hips and knees when helping the patient to sit in the chair. If the patient is unable to bear any weight, a second care provider will be needed to assist with this process to transfer the patient to the chair. The care providers will stand on either side of the patient. Have your feet shoulder width apart, with the foot closest to the patient slightly in front of the other. Place your arm closest to the patient under the patient's arm, taking hold of their shoulder. Bend your knees and hips. On the count of 3, use your legs to help raise the patient to a standing position. Keep your legs as close to the patient's legs to support the patient. Slowly turn the patient towards the wheelchair. Steadily lower the patient into the chair by bending your knees and hips. Remember to keep your back straight. Assess the patient's alignment in the chair. Make the patient as comfortable as possible. Assess the patient's pulse and compare it with the previous reading. Please note, if the pulse is 10 beats per minute lower or higher than the baseline data, allow the patient to sit for a minute. Take this time to observe and assess the patient for any signs of dizziness or lightheadedness before reassessing the pulse. Reassess the patient's pulse and compare it with the previous readings. If the pulse rate is more than 10 beats per minute higher or lower than the baseline data, assist the patient back into the bed immediately. Gently place the patient's feet on the footrests if a wheelchair is used. Cover the patient with a blanket if needed and ensure that the patient is comfortable in the chair. Provide grooming if necessary, for example, combing of hair. Place the call bell and other necessary items within the patient's reach. Make the patient's bed neat and tidy. Remove your gloves and discard thereof appropriately. Perform hand hygiene. Open the curtains around the bed and continuously check on the patient to ensure that they are still comfortable. When the patient spends the allotted time in the chair or becomes uncomfortable or starts experiencing pain, you will transfer them back to the bed. This is done as follows. Close the curtains again around the bed. Explain to the patient what you will do. Perform hand hygiene. Remove the call bell and remove the blanket from the patient. Lift the patient's feet from the footrests and take the footrests out of the way. Ensure that the patient's legs are together. Stand in front of the patient with your legs apart and place your one leg slightly in front of the other. Securely grasp the patient around the waist. On the count of 3, shift your weight from your front leg to your back leg as you assist the patient to stand. Pivot the patient or slowly turn the patient towards the edge of the bed. Lower the patient onto the bed by shifting your weight from the back leg to your front leg. Do not drop the patient onto the bed, as this may cause unnecessary pain and discomfort. Remove the patient's shoes and robe. Assist the patient into a lying position while lifting their legs onto the bed. Cover the patient with the top linen. Make the patient as comfortable as possible. Raise the side rails if required and readjust the height of the bed. Remove the chair or wheelchair and readjust the furniture to its previous state. Place the call bell and all necessary items within the patient's reach. Perform social hand hygiene before leaving the patient's room. Open the curtains around the patient's bed. Evaluation. The expected outcomes are met when the patient is transferred from the bed to the chair without any injury. Record keeping. Record the activity, including the length of time that the patient sat in the chair, any observations, and the patient's tolerance of and reaction to the activity. Record the number and names of the staff that assisted with the transfer, and remember to report any abnormalities to the registered nurse. Unexpected situations and associated interventions. While the patient is seated, they may find themselves slipping off the chair. In such an event, the patient should be repositioned on the chair. If the patient cannot reposition themselves, you should assist the patient using the following technique. If the wheelchair is used, ensure that the brakes on the wheelchair is locked in place. Swing the footrest out of the way and assist the patient to place their feet flat on the floor. Position yourself close to and in front of the patient on one knee, with an upright back. Instruct the patient to lean forward slightly and place their hands on the armrest. Place your one hand just below the patient's knee and the other hand behind the patient's opposite hip. Ask the patient to lean to the side of the stabilized hip. On the count of 3, the patient should push with the opposite arm and foot to lift the hip off the chair. Firmly push the patient's knee, still keeping the hip stabilized, so the patient pivots backward. Repeat the procedure for the opposite side and continue until the patient is repositioned to the back of the wheelchair. Assess the patient's alignment in the chair. Gently place the patient's feet on the footrests if a wheelchair is used. Make the patient as comfortable as possible. In conclusion, it is important to indicate to you that the healthcare giver is an important role player in providing comfort for a patient. Whenever patient care is provided, adherence to infection control guidelines is needed to ensure that all care is safe care. Perform your tasks as per this lecture and to the best of your ability, always keeping in mind your scope of practice.